Alright, today we're working with Ronnie. He's a 53-year-old who sprained his ankle 2 days ago. He's in the inflammatory or acute phase of healing. We're going to use ultrasound today to help reduce some pain that's associated with the soft tissue damage, so the ligament sprain. Some contraindications for this would be if he has active cancer, if he uses a pacemaker, we wouldn't want to go in the torso with the ultrasound. If he has impaired sensation or cognition, which we'll assess before we start the treatment. We aren't using thermal ultrasound because he still has swelling, and the heat will make that a little bit worse. And he has diabetes, so with the sensation check, we'll check blood flow as well in the ankle. I think that's it. Okay. So Ronnie, today we're going to do some what we call ultrasound. Basically what happens is we have this little head here, right there, that'll put some sound waves into your ankle, and what it'll do, it should help with the pain a little bit, and then it'll help that tissue heal a little bit faster so you can get back to what you like to do. Does that sound all right to you?
Yeah.
All right. So we'll set up the parameters here. We'll start, we just click on the sound there. We're going to go down to 3 megahertz because the lateral ankle is pretty close to the skin, so we don't have to get real deep with that. We don't want thermal, so we'll go a 20-second or 20% duty cycle with it, and then bump up the intensity. We'll keep it real low at 0.5 because again, we're going into bone, which absorbs a lot of the energy, and it's real close to the surface, so we don't need a whole lot to get in there and heat things up. We'll just set the time down a little bit just for this. Normally we would go about 5 minutes with this, see how he reacts, and then adjust for the next treatment accordingly. Alright, so we'll set Ronnie up here. Is that a pretty comfortable position for you there?
Yep.
Alright, so I'm just going to test some sensation on the side of your ankle to make sure where we're working is going to be safe.
Okay.
So when I tap, can you just tell me if you feel that all right there?
Yeah, now I can feel that.
And down there?
Yep, that kind of hurts over there.
Okay, understandable. And then what about back there?
Yeah, I can feel that.
You can feel that? All right, so his sensation's good. It looks like he has good blood flow, so our contraindications are cleared and we're good to go. So we'll put some of the ultrasound gel on the head here. There we go. And then from there, we'll put the head onto the skin here. And then once we have it on the skin, we'll get it started. And off we go. And we'll just work around in circular motions here about 2 to 3 times the effective radiating area of the head. And we'll just push it into the skin and go for about 5 minutes here this time and adjust depending on how it feels for him after this treatment. So we've done about 30 seconds here. We'll shut it off just for this video. How does that feel now, Ronnie?
Feel fine.
It feels all right. All right. Wipe this off. I'm just gonna open this up a little bit. So we'll wipe off all the medium there. And then I'm just going to check your sensation again just to make sure we're doing all right. It looks like you have good blood flow there, but can you feel that right there?
Yep.
And then what about down there?
Yeah, it feels fine.
And back there?
Yep.
All right, so we checked him out. He did great with the treatment today. And